So good morning, everyone. Hello, and welcome to the business case for becoming a baby-friendly hospital webinar. I'm Jennifer Delaporte, the breastfeeding specialist of the Prevention Services Division at the Colorado Department of Public Health and Environment, and will be moderating this webinar. So the purpose of this webinar is to inform you about the Baby-Friendly Hospital Initiative and describe some of the benefits of becoming certified as a baby-friendly facility. Our hope is that you'll determine this year to be good timing to join a Colorado hospital collaborative that will support hospitals through moving through the process to become designated baby-friendly. In the next week, you can expect to receive an invitation to apply for the collaborative. In July, hospitals will be notified of their acceptance into the collaborative, and then in August, collaborative members will be asked to complete a needs assessment to help inform the collaborative process. In September, members of the collaborative will be invited to participate in a networking and technical assistance workshop, and we'll give you some more information as time goes on. But to stick with the time, I'd like to start right away with the presentation. Today we have Dr. Marianne Neifert and Holly Fedak joining us to present on this business case for becoming baby-friendly. I'll just advance the slides here. Please make sure you're using your audio through your computer system speakers, and you feel free to ask questions and comment in the comment field in the right side of your monitor. So I am honored to first introduce Dr. Marianne Neifert, who is known nationwide as Dr. Mom. Dr. Neifert's a pediatrician and nationally recognized expert in lactation management. She possesses a strong theoretical background in lactation management and a wealth of practical experience. And since 2008, many of you have met Marianne as she's been traveling around Colorado, meeting with hospital staff to discuss how to support new breastfeeding mothers and babies, as well as train staff on the Colorado Can Do 5 breastfeeding supportive practices. Dr. Neifert is a longtime leader in the field of breastfeeding medicine, and we are so very, very lucky to have Marianne on our side and a resident of our state. And joining Dr. Neifert is Holly Fedak, who has served as the Chief Nursing Officer at Parker Adventist Hospital for over 5 years. And in this role, she's responsible for managing patient care operations, including nursing staff training, development, patient quality, and safety. Prior to joining Parker Adventist Hospital, Ms. Fedak served as the Senior Director of Women's and Children's Services at St. Joseph Hospital in Denver for 8 years. And before St. Joseph Hospital, she was the Service Line Director for Women's and Children's Services at St. Anthony North and Central. Ms. Fedak is a registered nurse with a master's degree in business administration. So together we'll learn a little more today about the business case for becoming baby-friendly. So let's turn to Marianne and Holly.
Thank you, Jenny, and thank you to all those out there joining us. We are going to make the case that pursuing the baby-friendly designation is going to benefit your hospital by offering the opportunity to provide high-quality care throughout your spectrum of maternity services and improve the long-term health of the families you serve. By offering the highest standards in evidence-based maternity care, you can engender staff pride and confidence and increase your patient satisfaction while enhancing your public image. And finally, you'll be able to be part of promoting a public health priority that helps reduce healthcare costs and potentially will improve your own hospital's bottom line. Well, I want to begin making the case for the Baby-Friendly Hospital Initiative by reminding us of the recommendations of the latest American Academy of Pediatrics breastfeeding policy statement. The AAP now realizes that breastfeeding is a public health priority and not just an individual mother's lifestyle issue. Breastfeeding is recommended for at least 1 year, with the first 6 months being exclusive breastfeeding. Breast milk is considered so important that if breastfeeding is not able to be done, that express breast milk or donor milk are recommended. And of course, continued breastfeeding throughout the first year after solids are introduced. Throughout the program, we intersperse some of the mission statements of the various healthcare systems in Colorado and remind you that pursuing the baby-friendly designation is in sync with your own highest mission and vision. Well, breastfeeding is important for maternal and infant health. The American Academy of Pediatrics policy statement outlines clearly all of the documented health benefits of breastfeeding and reminds us that breastfeeding benefits are dose-related. Just to give you some examples, any breastfeeding reduces the risk of ear infections by 23%, while exclusive breastfeeding for the first 3 months reduces ear infections by 50%. Everyone is aware of the devastating and costly illness in premature infants called necrotizing enterocolitis. Receiving mother's milk reduces this by 58%, but if mother's milk can be fortified with exclusive human milk products, we now get a 77% reduction in necrotizing enterocolitis. So these benefits are dose-related. You can read all this in the policy statement that can be downloaded from aap.org. The title of the policy is the use of human milk and breastfeeding and the use of human milk. The policy also addresses some of the maternal benefits of breastfeeding and reminds us that we have a growing body of evidence that these benefits also are dose-related, with evidence that cumulative breastfeeding experience reduces the risk of type 2 diabetes, rheumatoid arthritis, hypertension, hyperlipidemia, cardiovascular disease, and breast and ovarian cancer. So the dose-related is the new phrase. If 90% of mothers could achieve optimal breastfeeding recommendations, it's been calculated that we could actually save $13 billion a year in healthcare costs due to the improved infant and maternal health outcomes. So there are reduced healthcare costs for the nation if mothers are able to achieve their breastfeeding goals. There are also reduced healthcare costs for those paying for infant care, and this has been documented in Colorado in a very special study that compared Medicaid dollar cost in a cohort of breastfed babies in the WIC, enrolled in WIC, compared with a formula feeding control group. And the total Medicaid expenditures in the first 6 months were lower for the breastfed babies by $112, and there was a significantly lower cost for pharmacy expenses for the fully breastfed babies. No wonder so many U.S. governmental organizations endorse breastfeeding, including the Office of the Surgeon General, Institutes of Medicine, Office of Women's Health, Centers for Disease Control and Prevention, and USDA WIC program, and others. Every major professional organization that makes infant feeding recommendations also endorses the recommendations of exclusive breastfeeding for about 6 months and continued breastfeeding for at least 1 year. The AAP policy statement acknowledged that the WHO UNICEF Baby Friendly Hospital Initiative, their 10 steps to successful breastfeeding, do represent ideal hospital routines. The AAP has endorsed the 10 steps, and their paper called for a major conceptual change in the organization of hospital services to ensure that hospital policies fully support early and exclusive breastfeeding. We also have Healthy People 2020 process breastfeeding objectives that call on hospitals to make system-wide changes that will help mothers get the best possible start with breastfeeding. One of the goals is to increase the proportion of births that occur at baby-friendly facilities to 8% nationwide. Colorado is close to that, but we would certainly like to go more than 8%. The second goal related to hospital services is the reduction in formula supplementation for breastfed babies in the first 48 hours. The goal is 14%, and Colorado rate is presently close to 20%. Well, let's just spend a minute or so talking about the Baby Friendly Hospital Initiative. I think most of you are familiar with it. It's a global joint WHO-UNICEF initiative launched in 1991. The anchor of this are the 10 evidence-based steps to successful breastfeeding. The initiative has had wide acceptance worldwide, with 20,000 facilities being designated baby-friendly, but in the U.S., less than 5% of our 3,200 birth hospitals are baby-friendly. We are fortunate to have 3 baby-friendly hospitals in Colorado and several more on the path, but we know that we can do better than that. The 10 steps, just to mention them, are to have a written breastfeeding policy, train staff in that policy. If you have an antenatal clinic, inform all pregnant women about the benefits of breastfeeding so they make a truly informed decision. A real anchor step is step 4, to help mothers begin breastfeeding within 1 hour. by placing baby skin to skin immediately after birth. Step 5, show mothers how to breastfeed, including supporting mothers of premature infants to be able to maintain lactation when separated from their infants. Step 6 is an important one, not to give any unnecessary formula supplement to a breastfed baby, and this also involves the requirement for hospitals to purchase formula and stop accepting free formula. Step 7 is practice continuous rooming in 24 hours a day. I want to make a comment about Step 6 about the need to purchase the formula. Many hospitals are afraid that this will increase their costs and be prohibitively expensive, but in fact a recent study published in Pediatrics compared the cost per delivery at baby-friendly and similar-sized non-baby-friendly facilities and found that the difference was only $35 per delivery, $35 more at a baby-friendly hospital, and this difference was non-significant. And consider what you pay for being designated a trauma center or for other designations and redesignations. This is a minimal cost. Step 8 of the 10 steps is breastfeeding on demand, cue-based feedings. Step 9 is to not use artificial nipples or pacifiers with breastfed infants in the hospital. And Step 10 relates to the follow-up services that create a seamless transition from breastfeeding to support in the hospital to the community, and many hospitals are, of course, offering follow-up consultations and support groups. The good news is that the baby-friendly USA has simplified the process to become baby-friendly and clarified the step-by-step progress to make towards the designation, and they call it the 4D pathway, with the discovery phase, the development phase, dissemination phase, and designation phase. And so there's a lot more support and help in how to go about becoming baby-friendly. The reason we get so excited about baby-friendly is that the evidence is so clear that baby-friendly designated hospitals compared to non-baby-friendly hospitals, baby-friendly hospitals are linked consistently with increases in breastfeeding initiation, duration, and exclusivity. And the good news is while you're on the path, every new step you add helps mothers breastfeed longer, so that incremental progress towards the 10 steps makes a difference in breastfeeding outcomes. Just to give you an example, at Boston Medical Center, one of the first baby-friendly hospitals in this country, you can look at this more carefully later, but they experienced dramatic increases in breastfeeding initiation and exclusivity and breastfeeding among U.S.-born black mothers that have the lowest breastfeeding rates in the nation. And all of these went up during the process and after becoming baby-friendly, went up significantly. Another reason to become baby-friendly is that all hospitals are asked in a every other year survey conducted by the Centers for Disease Control and Prevention. They're asked to evaluate the usual maternity practices, and they're given a score based on a scale of 0 to 100. This score becomes part of each state's breastfeeding report card. Colorado, nationally, the score has increased from 65 to 70. Colorado's score on this maternity practices and infant and nutrition care survey is 77. However, Colorado still needs improvement in model breastfeeding policies, use of supplemental feedings, post-discharge breastfeeding support, and assessment of staff competencies. An exciting new thing that's going on is the new Joint Commission Perinatal Care Core Measure Set, in which the measurement of exclusive breast milk feeding is one of the 5 core measures. And this measure set is going to become mandatory effective 2014 for all hospitals with greater than 1,100 births per year. And so the Joint Commission is urging all hospitals to begin this now, and this has totally changed the paradigm that has been long-standing for decades, that we always assumed that supplementing a breastfed baby meant the use of formula, when in fact supplementing a breastfed baby can be done by expressing the milk, providing the expressed milk, which then helps the mother establish a milk supply and keeps the baby totally breast milk fed. Becoming baby-friendly will encourage your hospital to ban the formula gift bag, which is something long overdue. It's extremely inappropriate for hospitals to have this kind of relationship with industry. The formula gift bags violate the WHO Code of Marketing of Breast Milk Substitutes and undermines your hospital's efforts to promote good health. Fortunately, now less than 40% of Colorado hospitals still give a bag, and some states like Massachusetts and Rhode Island, no hospitals are giving a bag. This graph is based on Colorado data. This is now from 2011, and since then even fewer, but at that time less than half of mothers statewide reported getting a gift bag, and as I said, now less than 40% of hospitals give one. Another reason to become baby friendly is that we know that supporting mothers in their goals to breastfeed promotes patient satisfaction. Colorado has very high breastfeeding initiation rates, with 9 out of 10 mothers wanting to breastfeed. We know women make the healthcare decisions for their family, and when a family member needs hospitalization, mothers tend to be loyal to the hospital where she gave birth, especially if she had a positive experience there. So satisfied maternity patients can become ambassadors for your hospital. Mothers don't just bond with their baby, they bond with their hospital. Now, 5 of these baby-friendly 10 steps, known as the Colorado Can-Do 5, are 5 of the practices that a mother would be most likely to report. She wouldn't know if her hospital had a policy, if their staff got training, but she knows if her baby breastfed right away, groomed in with her, was fed only breast milk, didn't receive a pacifier, and knew where to turn for help when she went home. And we're very proud to say that this initiative called the Colorado Can-Do 5 has resulted in more than 60% of Colorado hospitals now doing all 5 of these practices, which means that nearly 2/3 of Colorado hospitals are already well on the path to baby friendly. Some of the bonus benefits to these 5 practices are many anecdotal reports that early skin-to-skin results in fewer babies with low blood sugar and requiring transitional oxygen because of the physiologic stability offered by early skin-to-skin. Continuous rooming in means that you get a bonus outcome of fewer infants cared for in the nursery at night. Exclusive breast milk feeding is one of the strongest hospital practices linked with long-term exclusive breastfeeding, helping mothers reach their own breastfeeding goals. Not giving a pacifier saves hospitals money. Some hospitals spend money on 2 or 3 pacifiers per infant, and so that's another cost saving. And having the follow-up support with individual consults and mother-to-mother support groups. As one director of women's services told me, that patient satisfaction surveys are through the ceiling. And indeed, Poudre Valley Hospital, which became baby-friendly a couple of years ago, their top box for 2011 was for mothers feeling that they had access to their baby often enough due to continuous rooming in. This also is one of the top satisfiers in Greenville, North Carolina, when their hospital system there went baby-friendly, and it went from 10% rooming in up to 100% rooming in, and extreme patient satisfaction with the opportunity to have their babies, access to their baby round the clock. Just a reminder of, again, of some of your mission statements that, and the way baby-friendly is in sync with that. Now, in order to stay ahead of the curve, it's important to realize that HCAPs are going to play an even larger role in reimbursement, and so the reduced health care costs might be could be an important benefit for you with the baby-friendly designation. This year, providers are going to shift from HCAPs pay for reporting to HCAPs pay for performance, and higher scores are going to count. There's also an issue of non-compensated readmissions. No parent wants to be told that their new baby needs to go back to the hospital, and successful breastfeeding can reduce non-compensated newborn readmissions for a variety of morbidities. For example, we know that successful breastfeeding confers all kinds of benefits, but ineffective breastfeeding leads to readmissions for excessive hyperbilirubinemia, excessive infant weight loss, and dehydration. It readmits for real-out sepsis, and particularly the late preterm infant is especially at risk for ineffective breastfeeding if not given adequate support. We urge you to try to stay ahead of the curve. Reimbursement is going to change for hospitals paid under the Medicare Inpatient Prospective Payment System related to readmission rates. The reimbursement changes are intended to incentivize hospitals to reduce overall readmission rates, and Medicare payments are going to be reduced if readmission rates exceed expected benchmarks. In summary, achieving the baby-friendly ideal is going to give your hospital the chance to provide high-quality, cost-effective, evidence-based health care and promote optimal long-term health for mothers and babies. You're going to have the opportunity to promote a public health priority that reduces health care costs, promotes maternal child health, decreases health disparities, and combats childhood obesity. And your staff is going to have pride knowing that you're committed to the highest standards in evidence-based maternity care practices that support long-term successful breastfeeding. So what's in it for your hospital? In summary, the chance to provide high-quality care, improve long-term health, offer the higher standards in evidence-based maternity care, increase your patient satisfaction, and enhance your public image while promoting a public health priority that potentially improves your hospital's bottom line. The Colorado Baby Friendly Hospital Priority is an initiative of the Colorado Department of Public Health and Environment. The goal is to reduce childhood overweight, which is rising very quickly in our state, and one of the evidence-based strategies identified to target that is to increase the number of Colorado baby-friendly hospitals. So hospitals that participate can receive technical assistance and potentially financial support. And yes, we said only 154 hospitals to date are designated baby-friendly, but the fact is that more than 500 are now on the path. We're on the brink of a mega trend, and you don't want to be left behind. So I'll let Jenny tell you what the next steps are, and then we'll hear from Holly. Thank you very much.
Thank you, Marianne. So what I'd like to do is make sure that you take a moment to send us any questions you have. At the end of this webinar in 10 minutes, we will encourage you to complete the evaluation, and handouts will be emailed to you when they become available of this presentation. So expect in early May an invitation to apply for the Baby Friendly Hospital Collaborative. So now, since we have Holly and Marianne here, I'd like to ask a couple questions of them. And Holly, you've certainly worked with many hospitals and moved toward baby friendly yourself. One question hospital staff have asked of me is, they say, I understand that breastfeeding is good for babies at my hospital. Why do we have to go through all these steps? Why can't I just advertise my hospital as being very supportive of breastfeeding?
Thank you, Jennifer. I think the reason that you can't just advertise that is because as you've seen here, Dr. Neifert has showed you, there is so much research and so much evidence coming to light, I think, in the last 5 to 10 years that you really need to use that evidence and really adopt those practices so that you can be very clear about what does make you a baby-friendly hospital. And I think we've gone through those, and I'm sure most of this audience is familiar with those steps and those challenges. You really do have to set forth that goal, and I think that's the first place to start, is to really make sure you've got everybody in your facility on the same page, particularly your nurses and your physicians, to be able to determine a vision for your maternity services and to be able to move toward that in a very methodical way. And then I think that is something that the public is looking for. More and more, we're finding our patients are very, very sophisticated. They're looking at research, they're looking online, and I think they want to come to the hospitals that have truly adopted these practices and are really baby-friendly hospitals.
And I also know that there's some research showing right now that you can actually do the 10 steps and not be a part of the baby-friendly initiative, and you do not have the same outcomes. And the thought is that you don't have anybody coming in to monitor you, an outside set of eyes, and so it seems like it's a certification. So another question is, how would a baby-friendly designation affect my medical staff, especially OBGYNs, and how can I enlist their support?
I think this is really key. It's key to have all your stakeholders on the same page. In the 15 years that I was working with women's and children's services exclusively, I found how incredibly important it was to ensure that the physicians had the same understanding as our nursing staff, because you don't want to have your nursing staff all on board and then have a physician say, well, I don't really care which way you want to go, or you can supplement, or do whatever feels right to you. You don't want to have any kind of wavering there. I think you really want to make sure that the medical staff has that same evidence and research and that same understanding. And I think there are a lot of opportunities within hospitals. With all the different meetings we always have, there's lots of opportunities, I think, to talk with your medical staff about that one-on-one and also in formal meetings around that evidence, and to be able to say that you really want to have a state-of-the-art maternal child unit, and that's the kind of care you want to deliver for all the right reasons. And I think the physicians by and large will go along with that once they have that understanding of the data that's out there.
And this is Marianne, and I just want to add that I do think that healthcare providers are very supportive of breastfeeding, and the education involved in becoming baby-friendly, I think, can be very empowering for them to give them more sort of tools in their toolbox to be able to talk to mothers and counsel mothers. And so, yeah, I think that they would benefit from the education and appreciate it.
Thank you. I don't see any questions coming in. I'm wondering if you have any. Yes.
Okay, this is Holly again. I'm curious, for those of you that are out there, what kinds of barriers are you running into? It seems we've talked so much about baby-friendly for so many years, and I'm curious now, what kinds of barriers are you continuing to run into? It looks like from the data we saw here that 60% of the hospitals in Colorado have gotten rid of the diaper bags from the formula company, so that's a really good step. I can tell you in my own experience, I looked at that from a financial standpoint, but I also talked to my compliance officer at my hospital, because more and more that's really become an ethical and compliance issue to allow a vendor to have all these free products in the hospital for patients. We don't allow any other vendors to do anything like that in our facilities. So that's another tactic if you're having trouble with diaper bags for any reason, to actually look at it not only from a financial standpoint, but from a compliance standpoint, ethical standpoint. But what kinds of barriers are you running into out there? Can you chat it? You want to tell them the technique to give us questions?
If you look on the right side of your screen, the little set of buttons, you should be able to open that screen up and see a chat function near the bottom. And if you click on that, you'll see a little place where you can type a question.
This is Marianne, and I want to just add that we didn't mention that there is a national collaborative or national initiative to get more, or maybe Jennifer mentioned that at the beginning, get more baby-friendly hospitals. And so there are 89 hospitals nationwide that have been applied for and selected to fast-track their journey to baby-friendly. And Memorial Central in Colorado Springs is one of those 89 hospitals. And one of the most valuable things I think we found in our state is when hospitals share their baby-friendly journey, and their own experience becomes so empowering for other hospitals to realize, oh, okay, you can kind of show us the pathway. And so we are learning through our Lactation Journal Club with periodic updates from Kathy Janoka at Memorial Hospital, what they are learning as being part of this collaborative. Do you want to add anything?
Can you tell them how they can go about being a part of that, of the 95 hospitals that are fast tracking?
Well, that is closed, so they can't be part of that, but they can learn from our own. They've been attending meetings. They've had a very detailed information sessions on how to do it, and so they can share that information and are willing to share it.
We have some barriers coming in here. One of them is, let's see, I'm having a bit of a push back from nursing staff, even though they know it's the right thing to do. They're so resistant to following all of the steps. Any way to get your nursing staff on board?
Yeah, I think this is unfortunately, it's a pretty common barrier, and I think what happens sometimes with the staff is, in my experience, has been the staff wants to give our patients choices, and they feel like that's kind of the American way is, well, let's let her sleep tonight and put the baby in the nursery, or let's do, was it low dose, they could do either one, and you have all these kinds of things. And I think, again, it comes back to a few things. I think it's that common understanding on the part of the nursing staff of what's best for the patient. What does the evidence show? And if you are putting yourself out there as a maternal child unit that uses evidence-based practice, this is evidence-based, and I think we have to help our staff, and this goes for everything in the hospital. We have to help them understand they can't opt out. We can't opt out of what does the evidence and research show us and do something different. Certainly not if we are saying that we're an evidence-based facility, and I think most of us would go along with that thinking. And I was thinking about this morning, and I was thinking, you know, when you look at the choice of breastfeeding versus formula, and a nurse is in a room talking to a patient about this, if that were a patient, an oncology patient, you wouldn't give that patient the choice of chemotherapy or using some beeswax or something else for their cancer treatment. We know the evidence shows that those chemotherapeutic agents are the best thing for those patients, so we wouldn't give them that kind of a choice. And so I wonder sometimes, why are we giving them the choice of formula versus breast milk? The evidence is very clear, and as I mentioned, very luckily we are getting more research and more evidence all the time about the benefits of breastfeeding. So I think getting your staff on board with that is really key. And unfortunately, sometimes that comes down to having face-to-face discussions. It may be a verbal discussion in their personnel file or even a written warning if you have to go that far. But I think the staff does have to understand that you're serious about it and they cannot opt out of evidence-based practice.
I know Jenny wants to add another question, but just two quick comments that we're in a state where 90% want to breastfeed, so the good news is we can tell moms that these are the things that will help you reach your breastfeeding goal, and also we're having a big thrust to educate mothers prenatally so they arrive at the hospital knowing what's good for them.
Yeah, thank you. It's true. I've never seen the evidence that says that formula is better than human milk for an infant. And so where else do we practice non-based, evidence-based research? But some of these questions actually, I think you just answered them with like a problem physician who had to supplement their own twins with formula, so therefore they think that everyone else. So that's just anecdotal, opinion-based, not evidence-based research. Or, you know, another comment that we're taking away sort of the free agency. Breastfeeding is getting a reputation of becoming a mandate, and they want to use a soft approach. And again, it's, are you practicing evidence-based medicine, or are you opinion, or yeah, what's best for the baby? So there is a question about a little more cost information, details on cost, the cost of becoming baby friendly. I don't know if you can speak to that with your experience with St. Joe's.
Well, I know when I was at St. Joe's, I know when we looked at the cost of this, I remember it was about $14,000 a year that we would have to spend by not having any of the free supplies from the formula companies. And I can't remember right at the moment what that was made up of. Part of that would have been any kind of formula that we had to buy. And then, of course, we did have to keep some of those real specific formulas for the NICU babies that needed special kinds of nutrients. There was a little bit of that you're always going to have. But as far as these healthy moms and newborns, that I think, as we talked about, you can take and work with your finance officer on those kinds of numbers. And I think what helped me a lot was looking at this from two areas, and it was from, as I said, the ethical side, that compliance side, with having free supplies from a vendor in the facility to give to patients, which we don't do in any other way in the hospital, and also the cost. So, and I think the slides that Dr. Neifert showed really did attest to some of the savings and kind of that break-even point with being able to breastfeed exclusively.
And that cost was at the largest delivery hospital in the state, so everybody else is going to be less than that.
Yeah, we're talking 5,000 births, right? About a total of 5,000 births, about $14,000. So I think we don't have any more comments or questions, and we're at our time limit today. So I'd like to thank our presenters again, Marianne Neifert and Holly Fedak, and thank you all for joining us. And this recording will be posted at a link, so that if you want to forward it on to someone who really in your facility you'd like to listen into it, please do. And again, the handouts will be sent to you in a link, as well as the evaluation shortly. So thanks again for your participation, and have a great day.